Good afternoon, everyone. This is Darlene with Generations Help. I do know we have some people calling in from the West Coast, so good morning. Thanks for joining us for our webinar, When You're Already a Worrier, Managing Anxiety During COVID-19. We are so grateful to have Belmont Village Senior Living sponsoring today's program, and in just a few minutes, I'm going to invite them to join us to share a little bit about Belmont. But first, there's a couple things I need to cover with you. The first is everyone is going to be muted throughout today's program. We are expecting a large group, and we want to make sure to eliminate any background noise. However, this is an interactive program, so we do encourage you to ask questions, to share any comments, to answer questions that Jen may ask, and you can do so by utilizing the chat feature. As a reminder, to find the chat, if you scroll across the bottom of your screen, you're going to see a banner that pops up, and on that is a bubble that says chat. When you click on that, that will launch the chat feature, and it'll probably pop up on that right-hand side of your screen. Now, when you use that, your questions, comments, answers, those are only going to come to the Belmont team, to Jennifer, and to myself, and that is for privacy reasons. However, Jen is fabulous about answering questions and addressing any comments that you have, so please feel free to utilize that feature. Okay, as I mentioned, we are so grateful to have Belmont Village Senior Living sponsoring today's program. And Nancy Convertito and Debbie Riley are joining us, and I would like to invite them onto the screen to share a little bit about Belmont with you. Welcome.
Thank you so much. We're so glad to be here. Welcome, everyone. I'm Nancy Convertito with Belmont Village Senior Living, and we're so glad that you've joined us this afternoon. I first met our speaker, Jennifer FitzPatrick, a few months ago when she was a keynote speaker at the Texas Assisted Living Association's yearly conference. Her expertise was evident and her energy was contagious. I knew immediately that we needed a partner for educational events. I'm delighted she's joining us here today. Belmont Village is a national leader in senior health and wellness, with 31 communities in the US and Mexico, 3 in development, and even more in the pipeline. We have a solid foundation of high standards in our buildings, in our hospitality, and most importantly, in our care. Serving seniors is our passion, and Belmont Village can meet those seniors wherever they are in their journey. We offer a variety of living options: independent living, assisted living, circle of friends, and our secure neighborhood for individuals with Alzheimer's or other dementias. Let me circle back to the Circle of Friends program. We found that individuals with mild cognitive impairments tended to self-isolate themselves due to fears of social situations. So with the help of experts, we created our award-winning Circle of Friends program, a non-secure environment where residents can be with their peers, with appropriate day programming designed to enhance function, encourage socialization, and instill a sense of confidence and a purpose. When it comes to senior living, we'd love to be a resource for you. From California to Florida, Texas to Illinois, and many places in between, we're here for you. So learn more about us at belmontvillage.com, and we look forward to hearing from you and seeing you at our next virtual educational event, which we'll have more information about next. Thanks.
Great, thank you so much. And again, thank you, Belmont Village, for sponsoring today. Okay, have you been extremely stressed out over the last 6 months? Or do you have a loved one whose anxiety has increased dramatically during this challenging time? If so, this program was created especially for you. Our presenter today is the author of Cruising Through Caregiving, Reducing the Stress of Caring for Your Loved One, and a longtime gerontology instructor at Johns Hopkins University's Certificate on Aging program. She is one of less than 800 certified speaking professionals worldwide and has been featured in national media such as The Wall Street Journal, Reader's Digest, U.S. News and World Report, CBS, ABC, and many more. When she's not working, she spends her time fantasizing about when she will be able to wander the aisles of TJ Maxx and Marshalls without a mask. Please join me in welcoming from Kent Island, Maryland, Jennifer FitzPatrick, MSW.
If you are not stressed out, we want to know your secret. This program that the team at Belmont Village selected is probably relevant to so many of us, because this is a situation that none of us have experienced before. But if you or a loved one identify already as somebody that worries, somebody that has maybe what you call bad nerves, or maybe you even actually use the term anxiety disorder, your stress level's probably through the roof, even more than everybody else. So today is all about looking at anxiety, looking at worry, looking at the stressful situation that all of us are dealing with right now, and trying to get through it in the healthiest way possible, figuring out how to deal with this difficult situation. Do these snakes scare you? Now, of course, many of you are probably saying, well, no, not since they're on a slide on my computer. But if they were in bed with me, or if they were on the sofa at my house, or if they were sitting on my desk, I might be a little scared. Now, there might be some of you that say, these snakes don't scare me at all. It's completely fine. You don't have a problem with snakes. But a lot of people have what we call a phobia about snakes. Even if it's a snake that's not poisonous or deadly, that we might be a little nervous or quite nervous if we see a snake. But in the case of a really deadly snake, it should scare you. It's supposed to scare you. You are not supposed to be thinking, you know what, please let a poisonous snake be in my bed or sit on top of my desk. It's supposed to scare you. And all of us are built with that built-in system in our bodies that says, if something is life-threatening potentially, I'm supposed to be flooded with chemicals so I am able to respond. And probably everybody knows about that. You've all heard of fight or flight. And that's what it's there for. That's what it's all about. But so many of us right now are struggling with worry, and we don't have necessarily a deadly snake in our bed. Now, it's good to be concerned and it's good to be cautious. There's a lot going on in the world right now that can be something that's concerning to us. If we have a lot of health issues, if we're an older adult, if we live with somebody that has a lot of health issues, if we work in healthcare, we might be very, very concerned about protecting ourselves from COVID-19 or from other conditions. But if we are constantly struggling with worry, we want to figure out how to manage that, because there is a way to manage worry. If you're working on a COVID unit and you don't have any PPE and everybody around you is very, very, very sick, it might be that you would actually be in fear, much like if these snakes were in bed with you. But if you're taking safety precautions, dealing with progressive, challenging, pervasive feelings of worry on a daily basis, most of us shouldn't have to deal with that. Now, that doesn't mean just because we shouldn't have to that many of us aren't. Many of us are right now. Before COVID-19 began to rear its ugly head in February, March, that people in the North America started to be concerned about it, 18% of us had an anxiety disorder. 18% of Americans have a diagnosable anxiety disorder. So if you already had obsessive compulsive disorder, or if your mom already had generalized anxiety disorder, or if your loved one already had, say, post-traumatic stress disorder, it's very possible that this time period has hit you or your loved one even harder than it's hit so many others. What's happening right now? So obviously everybody, if you weren't familiar with the term social distancing before March of this year, you are familiar with it now, and also the term abundance of caution. But back in February, back in March, we were introduced to the term social distancing. This was a brand new crisis. And if you remember, I sure remember, there was constantly new information. You may remember at the beginning of this pandemic, when we were all being told about it, many of us were given the data that 3 to 5% of our population could pass away from COVID-19. What a scary statistic. Now, we all know that any death is a tragedy, for sure, but this crisis has not reached that expectation, thankfully. But In the beginning, the World Health Organization was giving out information. CDC was giving out information. Different hospitals, nursing homes, senior living, home care, everyone, your state regs were constantly changing on what best practices were. But what hasn't changed is that even though thankfully that 3 to 5% of people that get this condition are not dying of it, it's so much less. It's less than 0.5% are passing away from this condition. It is a very serious threat to those who are very ill already, and it's a very serious threat to older adults. But back when we started to deal with this, it was brand new. But we did know that we had to be really concerned, but especially for those who were already ill and especially those who were older adults. Back in March, a very interesting study came out. What were people concerned with most at the beginning? And about half of the persons in this study were talking about the health of others. It wasn't that they were so worried about themselves. Only 11% said they were worried about their own health. But what the vast majority, or the most of the people, 46%, the biggest number said they're worried about the health of others. About 19%, they were worried about the healthcare system's collapse. And no matter what state you're in, I know we're doing this program nationwide, the healthcare system has not collapsed. Thankfully, we were all so terrified of that happening. But many of us were very, very concerned. There were ships being brought into New York and makeshift hospitals and beds, and everybody was very concerned. But 19% of us said collapse of healthcare system. 18% had concern about the economy. 15% just were worried about mass panic. And this study, interestingly, associated if somebody had intolerance of uncertainty, UI, uncertainty intolerance, if they scored high on that, meaning that they have a low tolerance of not knowing what's going to happen from day to day, from moment to moment, somebody that's on the more anxious side, of course, was more scared during this time. Now, I can give you an example. My husband is actually a pretty laid-back guy. And he has very high uncertainty intolerance. He can tolerate not knowing what's happening from day to day. He can tolerate not understanding fully a situation that might make other people a little nervous or a little bit worried. Whereas I probably have a much higher uncertainty intolerance score. But the more that somebody had an uncertainty intolerance scale score, and you can look that up if you're interested, the more fearful they were during that time period. They also found that the more that somebody exposed themselves to the media during this time period, the more afraid they were. And this makes a lot of sense because with the media, there was constant headlines, and it didn't necessarily mean we were saying 3 to 5% might die or hospitals will be overflown. I remember seeing big headlines about refrigerated trucks being driven to different states. And it was just a lot of panic and a lot of fear. And if you or your loved one were one of this 18% who already had a diagnosable anxiety disorder, even if you weren't formally diagnosed prior to this, your anxiety, your nervousness, your stress level was probably through the roof. Now, what are people concerned about more now? Now, I don't want to underestimate what we just talked about. A lot of people are still really, really scared that they're going to die, that a loved one's going to die, that a loved one's going to have long-term impact from COVID, that they're worried that the healthcare system will collapse, the economy will never come back. There definitely are folks that are still really, really concerned about those items. But right now, so we're 6 months into this, or we're recording this today, but if you're joining us for the live program, we're 6 months into this. And so there's a lot of people that have other concerns, other worries. Some people worry this is going to be forever. That wearing masks is going to be forever. That social distancing is going to be forever. That not being able to have a wedding or a funeral is going to be forever. And for a lot of people, that's actually more nerve-wracking and scary than being concerned that the healthcare system is going to collapse, because that might just be a trigger for somebody who is anxiety prone. Some people fixate on they really want there to be an a vaccine rather. Some people really want there to be a vaccine, but others focus, their anxiety goes to, well, what if the vaccine's going to be too rushed? And when we see headlines that, I believe one of the pharmaceutical companies disclosed that there have been some side effects for some participants that are not so good, that a headline like that might really, really ramp up the anxiety for somebody that's got that as a trigger, that on their mind. A lot of us thinking that our anxiety is being triggered by, we're opening up too soon. I know we've got the whole country on this program today, different rules, different states. And some people say, gosh, they're opening up too soon, or you're staying closed too long, and what are the impact of either one? And so somebody's anxiety could be triggered by that. And then others, what triggers their anxiety is restrictions on freedom, restrictions on what that person is allowed to do, who they can congregate with. For example, if they are not able to visit certain people, or maybe they have family overseas and they can't get to them because of all of the restrictions. So in the beginning, I think for a lot of people who had anxiety, it was very, very similar. The concerns were much less broad, but now there's lots that people are worried about depending on what is a trigger for them. So what I would love to ask you all to do, if you feel comfortable, is if you are somebody who is struggling with anxiety, tremendous anxiety, or even if you have a loved one, or maybe you're a professional that happened to join today and you have a patient or a client, feel free to write in, what do you think is most creating anxiety in your circle, maybe with yourself, with your friends, with people in your family. So feel free to write in, and it could be just one word. I'd love to hear from you. School. Yeah. That's a big one. And that opening too soon or being closed too long, that, oh my gosh, am I going to have to homeschool my children forever? How's my kids' mental health going to suffer? Are there going to be long-term impacts for mental health? Which, by the way, there is some data to suggest if we don't open things more normally for kids, there is going to be problems. Giving the virus to somebody that's more vulnerable, a family member's health, just the general fear of the unknown. The physical distancing is causing, one person saying that's causing anxiety. Having been exposed to COVID by a coworker, all of the above, what's going to happen with family celebrations. It's interesting because England actually has isolation leading to long-term mental health problems. Isolation for older adults, is this going to be how they end their life? Vivian, that's such a great point that you're making, because a lot of people, it's funny, I've had conversations with friends who have parents in senior living communities, or that have parents that live independently in the community, and they're saying, well, we're not letting them see the grandchildren, we're not going over there, we're doing everything by Zoom. And one of the things that I've talked about with them is, listen, everybody has to do what's right for them. Everybody has to do what they have to follow the local regulations. They have to follow what they feel is personally correct for themselves and their family. But Vivian, I think the same thing. If mom is 90 years old and perhaps this is going to be the last year of her life and she doesn't get to see her grandchildren again, is that something that, I don't know that there's a right answer, but that's something that that a lot of people have on their mind too. And Beth's saying, some stressors that she's hearing from clients, afraid if they don't follow the rules, they'll be quarantined or kicked out of their community. Not being able to see a family member before they pass, creating tremendous anxiety. Absolutely. Everybody, thank you so much for sharing what you're hearing and what you're experiencing. Political stress, COVID fires. Yeah, I mean, there's just so much happening at once. So who is struggling? So I want to talk a little bit more about who's struggling. And this is a more recent study that was done this past July. And some of the data says that anxiety and hopelessness right now, at least the study that happened in July with this group, said that women, those living with somebody that's high risk, those who are having challenges caring for kids, and those whose income has decreased, those are the ones that are experiencing the highest levels of anxiety. Now, let's go to the CDC. As you probably have seen, the CDC director, I think, has done a really lovely job of sharing the spin-off effects of the lockdown and some of the other concerns that he has as a result of what's going on in our world. Because of course he has to look globally at every disease, every condition that the United States is experiencing. And he's talked a lot about his concerns about mental health impact. So one of the right from the CDC website, and Darlene, if you wouldn't mind cutting and pasting this link into the chat section in case anyone wants to look this up for themselves. But in 2020, they did a study, and 40% of American adults are saying that they have mental health or substance abuse challenges right now. That's a lot of people. That's a lot of people, even if you're just doing a randomized study. 31% of us are saying that we are daily having anxiety or depressive symptoms. 26% are saying that they're having trauma-related symptoms. And 11% are saying that they're having serious suicidal ideation. This is some really, really, really important data. We just had another comment. I just want to make sure. Routines getting changed every couple weeks, not having a regular routine. Beth, I couldn't agree with you more. A lot of everybody, people raising children, workplaces, health and mental health workplaces, or any workplaces, we as human beings, we crave structure, we crave routine. Now, some of us are better with routine than others. Some people are much more spontaneous. I don't want to say that everyone likes to be in an exact routine every day, but having something to rely on, that we get our cup of coffee every day, that we take a shower, that we go to an office, that we get to hang out with family and friends on the weekend. When we're taking away parts of people's routine, it really tremendously can contribute to anxiety. Now, think about it. All this is happening, all these different reasons why people are feeling anxious. Remember, before this happened, 18% of us met the criteria for a clinical anxiety disorder. But now, 31% are saying they're having anxiety or depressive symptoms, and 40% are saying they're having either a mental health or a substance abuse challenge at this time. What's also happening, and what Beth says about routines being changed and how that can really be anxiety provoking, particularly for a lot of people with obsessive compulsive disorder, routine is what keeps them going. It keeps a lot of their symptoms at bay. And for many of us, a lot of our coping mechanisms have been robbed from us. What do I mean by that? I want you to tell me what coping mechanisms have been taken from you during this time. So not only do you have to worry possibly about older loved ones getting sick or getting sick on the job, or you're worried about a parent being isolated, or you're worried about your kid having to homeschool your kid. So you have all that additional stress and all the headlines that said, oh, maybe 3% of people that get this terrible disease are going to die. What coping mechanisms have been taken away from you during this time? Because a lot of people have been taken away during this time. So feel free to write it. Think about it. Just write one word. What's a coping mechanism that's been taken away from you during this time? Something that you enjoyed being part of your routine. So Tina says being around her family and friends is a coping mechanism. Difficult. You don't have anything to look forward to. Visitors, trips, vacations. Taking the gym. Yes, the gym. Going out to eat. Yeah, the gym. Somebody else saying the gym. Because in a lot of places, gyms aren't open. Just getting your nails done, pampering yourself, going to the theater. I'm going to share with you one of mine. I absolutely love dancing. Oh, Vivian, I keep joking that I feel like we're in this weird remake of Footloose, because while I'm very fortunate in Maryland, and especially in the town where I live in, a lot of our outdoor dining is open, and where I live, there are a lot of there in our town where we live, there's a lot of outdoor places with music. And one of the things that happened early in the summer season, what was told to us, was that a lot of the local establishments and restaurants and pubs that were on the water where we live, where we could do outdoor dining, they specifically weren't allowed to have music that encouraged dancing. And it just blew my mind. So for for Vivian, I hear you about that dancing one. Leslie, hugs. Yeah, hugs are a big coping mechanism for a lot of us. And especially, I remember in the beginning of this, I thought to myself, people that they weren't on, they weren't social distancing with others. Maybe they didn't have kids or a spouse or family. Leslie is saying we're a hugging industry. Yeah, senior living, healthcare, we're definitely a hugging industry for those who work in this field. But one example of a coping mechanism that got taken away from me, and again, this is definitely a first world problem, but I always enjoyed getting a massage every couple of months. I really always enjoyed just going in and getting a massage. And for months, that wasn't permitted in Maryland. And now it is permitted, but you have to wear a mask. And I just can't imagine, I don't think I would find it as relaxing to have my head in the little cradle wearing a mask. I think it would just be too difficult, too claustrophobic for me. So think about anybody and everybody that you know who's struggling, in addition to all these additional stressors, that for many of them, they've lost a lot of their coping mechanisms or their healthy ways of dealing with stress. And so I'm going to repeat this a couple more times before we end the program today. We definitely have to remember that we want to encourage people to find other coping mechanisms until the ones that they're missing are back. And I believe that they will be back at some point very soon. I'm very hopeful. So what's the difference between normal fear and an anxiety disorder? So, and I want you to really be thinking about these definitions. The American Psychological Association's dictionary discusses fear as an appropriate short-term response to a present identifiable threat. So let's say that snake is in your bed and we know that it's poisonous, and our body just goes into fight or flight mode. We're going to either attack that snake or we are going to run away from that snake. And it's a short-term response. It doesn't last. Fear doesn't last. Fear isn't supposed to be coursing through your veins all day. But that's what happens with anxiety. And anxiety is future-oriented. It's long-acting, and it's broadly focused on a diffuse threat. So I just read an article, then you probably have seen, there's a lot of articles, there's a lot of people who are so afraid of potentially getting COVID, that they believe that their risk is very, very high. And I'm not going to judge whether it is or whether it is not, but I've read first-person accounts of folks that have not left their homes at all for 5 months, for 6 months, that they have not seen another human being. And so, not to say that for some people that might be the right decision, but for some people it's possible that that could actually be an anxiety response, because we have to look at everything in life really is a risk-benefit analysis that we're supposed to be doing. Now, let's talk about fear again for a minute. Fear, if someone tries to cut us off in traffic and they almost hit us, we're going to have a burst of fear that's going to give us that hyper vigilance, that we're going to be able to respond to that car. We're going to either be able to swerve or we're going to be able to brace ourselves. But if we're riding in our car all day, sitting around in the car, worried that we're going to get hit, that's more of an anxiety response. And again, listen, I'm not here to say that somebody should or shouldn't, what level of concern they should or should not have over the coronavirus, but there are a lot of people that are probably at a lower risk that may be having an anxiety response, that especially if they previously had an anxiety disorder. So what is a true anxiety symptoms? Heart palpitations, chest pains, shortness of breath, having a hard time swallowing, dizziness, lightheadedness, feeling shaky or trembly, hot and cold flashes, feeling tense in the muscles, and in particular in your quadriceps, because when your body's getting ready to run, it sends all kinds of energy to your your legs and your quads. But also it can be in your shoulders, in your back, stomach upset, irritability. Oh, so I'm sorry. So we're talking now about psychological symptoms. So there's physical, there's psychological, and then there's cognitive symptoms. So psychological symptoms: irritability, nervousness, feeling tension without the stimulus. So Again, if we are driving in our car and we're constantly anxious and worried and nervous that we're going to get into an accident, that would potentially be an anxiety symptom because there's no stimulus right there. And if anybody has any comments or questions, feel free to write in on the chat section. Psychological symptoms can also include flashbacks. So right now, some people are experiencing anxious symptoms. Maybe they personally had COVID and they had a very bad time with it, a very bad bout with COVID, and maybe they were put on a ventilator and they might be having flashbacks of that time, or they're having flashbacks. Maybe they wake up in the middle of the night and their loved one, they're thinking back to when their loved one had been in the hospital with COVID and they weren't able to visit, and they're having a tense experience thinking about that time period. But fatigue, hypervigilance, so being on guard, being on edge at all times. Perfectionism. We're seeing a lot of perfectionism right now as a response to COVID-19. People just really being so concerned about the exact way to wear a mask or to put gloves on or to sanitize. And listen, I'm not suggesting that people shouldn't be vigilant and do what they and their healthcare professional feel is best practice for them, but it's very hard to be perfect with hygiene all the time, and especially if somebody has a proclivity toward, say, obsessive compulsive disorder, this can be particularly difficult. Restlessness, worrying and ruminating, thinking about it all the time. What if I get it? What if my mom gets it? What if I spread it at work? What if? Worrying and ruminating are a lot about what ifs. Feeling keyed up. A lot of people will use that term. Cognitively, we have difficulty concentrating. So a lot of people, part of the anxiety is a hard time concentrating right now. Disproportionate concern for issues. Now listen, I want to be clear again, are there outliers? Absolutely. I'm not a physician and I'm not saying that COVID is not a serious condition for many people. It has been and it is. However, most people that are going to have the biggest issue, and this is one of the reasons that our older adult, if you work in healthcare or senior living, older persons with multiple health issues are probably most at risk. Younger people, sure, can they pass away from it? Can they get extremely sick from it? Absolutely. But again, disproportionate. So for a lot of people, a disproportionate concern you have no underlying conditions, you just had a physical, you're in perfect health, you're 25 years old. It's highly unlikely that there is a reason for you to be overly concerned, but you can't stop thinking about it. But this can also, cognitively, for anxiety, that could be about finances or family issues or work. Right now, though, there is actually proportional concern for a lot of people about, so say somebody is 95 years old, they have 7 or 8 different ailments, they live in a nursing home and they have 4 roommates. And I have gone to nursing homes, and I'm sure many of you have, where people do have 4 roommates. Maybe they're concerned, if they're really concerned all the time and they're really hypervigilant, perhaps that is proportional. If somebody has a small business right now and they're not able to open and their spouse is a stay-at-home parent, that might be proportional, that they're very, very concerned about finances. So having concern about health, finances, family, work, etc., that does not mean that it's an anxiety problem, but when it's truly disproportionate. If you have $10 million in the bank and you obsessively worry about money. People who have anxiety disorders, true cognitive symptoms of anxiety, have challenges with the ability to understand that the concerns may be disproportionate. So let me I'm going to pull out of health and COVID for a minute. And let's talk for a moment about money. Let's say you're talking somebody who truly, truly has an anxiety disorder. They have $10 million in the bank and they have an income that comes in every month. They own a home, but they sit around and they think about losing their money, not having enough money to retire, not having enough money to pay for their groceries. Somebody that has a true anxiety disorder, even though they're worrying, oftentimes they are going to be able, if they talk to a therapist, if they talk to somebody who often they can be, it's not necessarily going to stop their worrying, but they are going to be able to rationally in a lot of cases, understand that their worries are perhaps a bit disproportionate if somebody uses logic and reason. Okay, so just want to go through real briefly. There are a lot of types of anxiety and trauma disorders. Just real briefly want to go through some of these just to show you some of the different, and really the only people that can diagnose this are physicians and often in many states, clinical social workers, psychologists, psychiatrists, I think in a lot of cases, nurse practitioners, depending on the state, physician's assistants. So a lot of different diagnoses. And again, remember before COVID hit, 18% of us already met the criteria for one of these. So you definitely knew somebody, whether it's yourself, whether it's your mom, whether it's your sister, whether it's your spouse, you know people who already had this before COVID, and probably for a lot of those people, their nervousness has been dramatically impacted. So what can we do now? If you are struggling, and what I want everybody to do right now is I want to invite you to write in any comments and questions about what you're doing right now or how you're guiding your friends or your family or your parent, or if you're a healthcare or mental health professional, your patients, on how to cope healthfully. So what can you do now? For one, to a certain extent, I think normalizing it can help. Remind yourself a lot of people are struggling right now. Now, one of my best friends I just spoke with on the phone, she is dealing with a ton of caregiving issues. She is dealing with a high stress job. She's dealing with caregiving for her parents. She's dealing with childcare issues for her daughter. And she was just having a really bad day, and she started crying about how stressed out she was. And I said to her, all of that is a lot right now, but I want you to remember, you're not the only one. All of that just by itself is a lot. But the fact that we talked about a lot of your coping mechanisms are no longer available to you. Some of you brought up going to the gym. She loves to go to the gym. Her gym is closed in her state. She loves to get a massage. She loves to go on vacation. She has not gone on a vacation since all of this began, even for a long weekend. So to normalize it, and don't beat yourself up. A lot of people are struggling right now. It's probably not just you, so know that. Tina says one way that she likes to remind herself that she's doing a good job taking care of herself and walking. And I swear, walking got me through the winter part, the colder months of this. And I don't think I've ever walked so much in my whole life, Tina. Again, acknowledge the coping mechanisms that have been taken away from you, whatever they may have been. Now, for some people, maybe your coping mechanism was you're taking care of your elderly mom and your kids are in school all day and now they're not, or now they're going to school and you're getting letters home that they're fiddling with the mask and that they're complaining about wearing a mask. That time that you had just to focus on taking care of your mother, just knowing that you had school to rely on, perhaps that's a coping mechanism that has been taken away from you. Hugging a family or friend, being able to go to the gym, being able to go to a party. Another coping mechanism, and I know this is going to sound a little odd, but think about funerals even. Right now, we have taken funerals away from most people, or what most of us for our ritual for grief. So if we do lose someone, and again, during this time period, most people are, there's lots of people dying of many other conditions besides COVID, many other conditions. And if you're not able to grieve properly, that's a coping mechanism that religions and cultures have created so people can cope with a major loss. And if you weren't able to grieve the way that your religion or your culture says is normal during this time, and you've lost somebody, you're probably really struggling with that. So I'm not just talking about exercise or a vacation or hugs. I'm talking also about coping mechanisms for when you do have a grief situation, or when you have a loved one who's sick or in senior living. For a lot of you, maybe, you placed your mom or your dad or your spouse in senior living, and you really rely on the fact that I can go in whenever I want. And right now that for most states is not really possible. And so just acknowledge that that was a coping mechanism. That was the way that you coped with, maybe some guilt that you were dealing with from, placing your loved one. Maybe it was for many families, such a really difficult decision. Stephanie's saying bicycling and just being outside has helped. Laura, yes, we are recording this, and the team at Belmont Village will make sure that you get that recording. Reach out to your doc, your primary care practitioner, and/or a licensed psychotherapist. Now, in most states right now, sadly, they are doing telehealth unless there's an absolute emergency, which is definitely better than nothing. And in some ways, I think that's great, because I think there's a lot of good uses for telehealth. But for mental health, a lot of times, we do tend to really want to see that somebody in person. But for right now, for many states, it's telehealth. But reach out, let your primary care practitioner, your doc, know that you're struggling if you are, or that your loved one is struggling. And if you have a psychotherapist, or if you're open to a psychotherapist, believe me, I think one of the silver linings of right now is that people are much more transparent and vulnerable and talking about their emotions and talking about their challenges. And in some ways, as awful as this situation has been, there's been so many challenges and so many difficulties. It's the first time I think that the whole world has felt exactly the same way, just frustrated and angry and worried. And I'm not saying that that's a good thing, but in a certain way, talking about your mental health is probably less taboo than it has ever been, especially if you're somebody that's pretty private. Remind yourself one way or another that this situation is temporary. You are going to get back to a routine. We are going to get past this, that you've got to look and remind yourself that everything that's happening, eventually you're going to get back those coping mechanisms. You're going to get back that ability to spend time with other people. And I think I'm going to speak to that for a moment about the uncertainty of intolerance, the UI. I think that's one of the hardest things. If you recall back in March, most of us were told, or I think all of us were told, let's just flatten the curve. 2 weeks, we'll close down. And we're on 6 months in a lot of places, or 5 months or 4 months, where a lot is closed and very little's open, and there's so many restrictions. And it doesn't feel temporary anymore. And it's really, really important to remind yourself that we are going to get through it. Stay informed, but limit the unnecessary triggers. So when I talk to someone that's particularly anxious, I say, how much news are you watching? How much news are you reading? And oftentimes I have friends and colleagues who say, well, I've got the TV on all day. And being informed is crucial, but being constantly bombarded with headlines and information and unnecessary triggers, or conversation with people who are just really tense, moods are contagious. And when the tone of a newscast, or the tone of spending time virtually or in person with somebody who's very, very anxious and very worried, it's contagious. Allow yourself the opportunity to vent. Find somebody that you can vent to. If it's not a therapist, I think a therapist is a great idea. I'm a former therapist. I believe in therapy very much, but I think that we have to allow ourselves the opportunity to vent to somebody, whether it's an online chat group, whether it's friends and family that love us virtually or in person, or whether we join an online support group during this time. Give yourself the permission and the space to vent. I mean, we don't want to just sit and wallow and only think about what we're upset and anxious and worried about, but we want to give ourselves space to just be able to express, to cry, to get angry, to get upset. Focus on what you can do and what you can control. And one of the things right now that my husband and I are really trying to focus on, or he keeps reminding me to focus on, is I travel a lot before all of this started. And thankfully I had for many years a virtual side of the business. But my husband and I always thought, well, wouldn't it be great if we had like a lot of time where neither one of us had to go anywhere? Well, we sure got it. Be careful what you wish for. And so what he always tries to remind me of, because believe me, I'm not somebody that doesn't struggle with what everybody else is struggling with. to focus on, hey, isn't it great that we get to spend so much time together? And it really is. And so try to focus on what you do like about the situation. Get the facts from legitimate sources. I've been reading some really terrifying studies that people have dramatically overestimated the number of people who have been sick with COVID or that have died with COVID, or the likelihood that they personally will get very, very, very sick. From day one, the legitimate sources have said the vast majority of people who get COVID will have mild cases, the vast majority, and that has remained true. So, and there's many, many resources that you can see that on, but get the facts from legitimate sources. Don't just read headlines. If you're watching your favorite news program channel, whatever that may be, and you're seeing the scroll go by, it's to entice you to stop, to watch, to turn up the channel. If you're flipping through the internet or social media, the headlines are intended to grab you. And so know that if the headline says shark flying in the sky, it might be that the story is about, oh, somebody thought that they saw a shark flying in the sky. Just be careful about seeing a headline and believing it to be true. Read, is it from a legitimate source? Try to be in the moment. What do you want to remember from this time? And again, I know there's a lot of negative about this time period, a lot. But is it that you're spending extra time with your kids? Is it that you're getting into great shape? Is it that you are getting a lot of work done? Is it that you are redecorating a room in your house? And again, I'm not trying to be glib when I say that, but and I think all of us should be doing what we can to, if we don't like or to share our opinions, or to I'm not saying just blindly accept things that you don't like that are happening in your area, but also think about, like, what can you do in the meantime until things get back to a way that you're going to be more happy with, or that you're going to feel less anxious about. Obviously, being mindful about diet, being sure you engage with others who you love safely, limit speculative conversation with somebody that's not an expert. Consider the humor. Back when you couldn't find toilet paper, somebody on my team sent me this picture at the grocery store. It's a cake that was in the toilet paper aisle, and we've kind of dined out on this picture, just thinking how funny it was. It wasn't funny, but it was funny. Try to find the humor in this difficult situation. Meditating, practicing gratitude, exercising. None of these strategies take the place of medication when it's needed and prescribed by your doc, or talk therapy from a good licensed therapist. But these are some things that you can do to minimize some of your anxiety response during this difficult time. And a lot of you have already done this. I also want to mention that while we get into whatever the new normal is going to look like and get past some of these challenges, that there's a lot of data that suggests that we're going to see a lot of the anxiety and mental health get worse before it gets better. Some people aren't experiencing anxiety or depression right now, but it's coming. That it's going to take time, sadly, for them to reach a rate where it's more noticeable. So keep an eye on people you love. And this is just one study about children. And this is one study about the general population of adults, the general population, patients, as well as healthcare workers. It's entitled PTSD is the Second Tsunami of the SARS-CoV-2 Pandemic. So many experts that I know, and I would include myself in this group, I believe that the mental health impact of this pandemic is going to be much further reaching than the physical illness that people are experiencing. I think it's going to impact far, far more people. But take good care of yourself. Don't be afraid to reach out to your doctor or to your mental health provider during this time. And know that you have the power to try to make this time to focus on feeling grateful for what you are grateful for, and taking this time to learn how to deal with some of this difficulty, with whether it's with self-care practices like exercise that many of you mentioned, meditating, riding your bike, being outside. But also, we have to never forget that life is all about risk. everything in life is about risk. Walking out your front door is about risk. And if you're a particularly anxious person, and if you have high uncertainty of intolerance, it's something to keep in mind. No one can ever guarantee what's going to happen, whether someone's going to die of COVID, or whether someone's going to die of another condition, or whether someone's going to get hit by a car. But it's all about making the best possible choices for yourself. And when we have an anxiety disorder, if we're dealing with really debilitating anxiety, it's really hard to do those cost-benefit analyses for ourselves and for others. So if you need professional help, please don't hesitate to go and get it. A couple other people are saying reading, just listening to good music, and keeping your mind busy with enjoyable tasks. Thank you so much for that, Otto. So what we're going to do now, I want to just introduce again our, I'm going to bring it back over to Darlene. Darlene is going to reintroduce the team at Belmont Village. We're going to keep this open for them to chat with you for a few more moments. And then we also are going to keep the chat log open for any more comments and questions. But for the time being, we're going to have Darlene turn it over to the team at Belmont Village for a few moments.
Awesome. Great. Thank you so much, Jen. And yes, as Jen mentioned, we're again so grateful for Belmont Village Senior Living for sponsoring today's program. And I would like to ask Debbie Riley and Nancy Convertito to join us again. We have a little more information to share with you. So thank you both for being here.
All right, there we go. Thank you, everyone. Jennifer, this was an amazing presentation. I know for myself, my anxiety is down a bit more, so I thank you personally. Thank you for all the participants on this Zoom. I believe you're probably feeling the same way, so thank you so much. So great segue for upcoming events with Generations. So we have on September 16th, recognizing and responding to burnout and compassion fatigue during a healthcare crisis. Then on September 23rd, boundaries in caregiving, preventing and avoiding the martyr syndrome. And then on September 29th, helping our patients and clients avoid the dangers of social isolation and loneliness when they are social distancing. So take a quick picture with your cell phones with this. That's kind of what I did through the presentation, which is always quick. And of course, this is being recorded. Also, and keep the chats coming in, because I know Jennifer will talk about that. But we are going to show a video at the end. It's a very special video that was made by some people I'm sure pretty confident you'll all recognize. They have a really special loved one at one of our LA communities. And these wonderful people put this video together for our frontline staff. And it's, you know, it's beyond thankful to all of our frontline staff that make them feel very, very special. A couple of them had tears in their eyes. So when we get to the video, I certainly hope you enjoy. And they did this specifically for Belmont Village because they love us so much. So I do hope you enjoy the video. Thank you all again. Just be a second.
Yeah, bear with us for just a moment. I'll be pulling that up. Hang in there for just another moment. Thank you.
There you go.
Belmont Village, thank you from the bottom of my heart. Cynthia, Norma, Diana, Wendy, Elizabeth, Stephanie, Gerald, Carol, Karen, John, Dalton, Sylvia, Lucy, Brenda, Rosa, Victoria, Charmaine, Sophia, George, Tanya, Etta, Jennifer, Arena, Will, Mario, Fernando, and the entire Belmont team were truly amazing. I cannot imagine the personal sacrifices you make every day to care for our loved ones. Humbled by your care for my incredible mom, Helen, who I love so much. I so appreciate you keeping her safe and very controlled. You are true heroes on the front line. Belmont Village.
Hi, everyone. I just want to say a big thank you for all the stuff and nurses at Belmont Village.
So I also want to say what Victoria said, thank you to all the nurses and staff for looking after our Helen. She's a very special lady, so please look after her well and give her a big kiss from us. So we can't wait to see her soon. Take care, everyone. Look after yourselves and stay safe.
Belmont Village, I really do do such an amazing job. There are so many people. I really want to thank you so much for taking care of beautiful Mama Helen Davis. She is so loved by me and loved by her family. And I know that it is such an amazing thing that you guys are doing. All love you so much and appreciate you, and God bless you.
Ken, so grateful for how you've been taking care of Mom Helen. We all love Mom Helen, and we are grateful for that too. And I just want to say thank you so much. We know you guys have sacrificed so much, you know, with regard to not being with your families and just being on lockdown. And we're just glad that, you know, there's somebody there for the family members when their blood can't come and see them. So thank you so much. And hopefully we'll get through this and you can see your families, and I'll be able to have sushi with Mom Helen, even though I don't really like sushi. I just get the raw shrimp. Anyway, thank you. I'm gonna start crying. Okay, so thank you so much for all that you do, and God bless you and keep you and your family healthy and safe.
I just wanted to send a big thank you to all the pals and nurses and staff at Belmont for taking care of Mama Helen Davis. We love our Mama Helen, and I know you guys have been working so hard to take care of everyone there. So many of you have families and are mothers and fathers and have stayed away from your own families, taking care of our mothers and fathers. And so I thank you from the bottom of my heart. God bless you. Stay safe, and sending you all my love and light.
Belmont Village, thank you from the bottom of my heart. Cynthia, Norma, Diana, Wendy, Elizabeth, Stephanie, Gerald, Carol, Karen, John, Dahlia, Scovia, Dulce, Brenda, Rosa, Victoria, Charmaine, Sophia, George, Tanya, Etta, Jennifer, Arena, Will, Mario, Fernando, and the entire Belmont team. You are truly amazing.
Great. We're so sorry about the technical challenges with the video, but we do appreciate Belmont Village. Thank you so much. We are grateful for your sponsorship and for offering this program. This is a caregiver program. However, we know that we have credited courses coming up as well. The slide that was shown earlier does have a list of the upcoming programs offered by Belmont. I hope that some of you will be able to join us. I'll leave this open for another moment in case there are any questions. But again, thank you, Belmont Village, for sponsoring today. Thank you all for joining us. Hope that you have a wonderful afternoon, and we will look forward to seeing you soon. Thank you so much for your time today.